And when you think about someone suffering from a stroke, a child might not be the first victim who comes to mind, but it can happen. Fox 2's Molly Rose is talking to a doctor this morning about what symptoms to look for. Molly?
Yeah, Randy, Dr. Kristin Guilliams is with Children's Hospital in St. Louis. That is the only hospital in our area with a dedicated pediatric stroke clinic. Doctor, thank you for being with us this morning.
Great, thank you for having me.
Of course, we would love to hear, do children experience the same types of symptoms as adults do when they experience a stroke?
Sure, yeah, so actually they do experience very similar symptoms. So the mnemonic that we think of for kids and adults is be fast. So thinking of if you're having trouble suddenly with balance, or E for eyes, if you have trouble seeing out of one of both eyes. F for face. So if one side of the face starts to droop or isn't working as well as the other. A for arms, if you're unable to lift both arms equally up. S for speech, so difficulty speaking or being understood. And then T is time, because stroke treatment is time dependent. And so if you have any of those symptoms, then it's time to call for help and call 911.
Such good information. Which children are most at risk for a stroke? Is it children at a certain age? Is it boys? Is it girls? What can you tell us about that?
Sure, yeah. So surprisingly, it's actually one of the highest risk is babies who are being born in that first month. There's something really unique about the balance between the clotting system and making sure that enough blood can flow through the placenta in order to get the blood through the umbilical cord to give the nutrients the baby needs right before they're born. But also the body's trying to protect the mom, that she doesn't hemorrhage out and lose too much blood when she delivers. And so changes in that can cause some clots that sometimes can travel through the umbilical cord and cause a stroke. So that first week of life is actually the highest week if you just pulled a random week out of your life for anyone having a stroke. But after that we know that kids of all ages can still experience strokes.
And is it true that oftentimes maybe a baby or a kid can have a stroke and it's just completely overlooked? You don't even know that it happened.
Yep, nope, that is very true. That sometimes it can, because sometimes they can even happen before a baby is born, and we don't know. And sometimes that it's not until later on, as the baby's growing and developing, that if you realize that your baby is clearly one-handed preference. So if they look like, wow, really is a lefty baby and they're only a few months old, that's a little bit unusual and something worth talking to your pediatrician and possibly coming either to the stroke clinic or seeing one of our pediatric neurologists to understand why your baby would have a hand preference, because that wouldn't be normal before about 2 or 3 years of age.
Yeah, something good to look out for. Thank you, Dr. Kristin Guilliams.
Yep.
We appreciate your time.
Great, thank you.